Hi, I'm Dr. Blair Schmaus from Symmetry Spinal Care, and today I just wanted to give you a little bit of information about scoliosis. It's not very well understood, but most people have a picture in their head of what scoliosis means. So a really bent over spine with a hunch. That's not always what it is. In fact, there are two very different categories of scoliosis. One that most people are thinking of is called anatomic, or mechanical, or pathological. Those are three names given to a scoliosis where at least one vertebrae is malformed. So instead of being a nice square, it's triangulated. Sometimes there are multiple vertebrae that are triangulated. That malformation is not really fixable with any chiropractic or physio or massage technique. Sometimes surgical intervention is used for that to try and straighten out the big bowing. The other kind, though, idiopathic scoliosis is its main name. It can also be called physiologic. It is muscle-induced. So the bones are built square, they're built right, but the musculature is pulling the spine into a bend. So an example of that is beside me here, where you can see one leg is pulled up short, the hips are off square, the spine has a bend to it because the muscles on the right side are pulling tighter. Now that idiopathic or physiologic scoliosis is by far the most common. Some studies suggest 80, 85, or even 95% of scolioses are this kind. The bones are built right, the spine is built right, but there's a curve. And that curve can be mild, moderate, or awful, and technically doesn't even get the name scoliosis unless it's bigger than 20 degrees. If we catch this kind of scoliosis, small, medium, or large, we can fix them. If it's anatomic, pathological, that other kind that most people think about, that small minority, we can't fix it. That, again, it may be surgical. The trouble that we run across is that a physiologic scoliosis, this kind, can eventually become the anatomic kind. The bones can eventually remodel into triangles. That's not good. Generally happens after a growth spurt. So in girls, their growth spurt's usually through about grade 6 to grade 10. So fixing it before that's really important. Fixing it after that is harder and sometimes limited. In boys, the big growth spurt is anywhere from grade 7 to first year university. Again, fixing it before that is best. After that is harder. Then there's another group, a group of people who have the anatomic scoliosis, which they can live with, not usually painful, but visible. And then they get an injury, which gives them this type on top of that. Now they have both layered scolioses. In that case, we fix the new one and try and stabilize the anatomic one. I hope that gives you some information. If you have questions about your own back or somebody you know, feel free to give us a call, drop us an email, or come in. We can do some measurements and see what you've got. Have a great day.